Today we're talking about tennis elbow. And yes, to answer your first question, you can have this even if you have never touched a tennis racket in your life. Today we're going to talk about what it is, what causes it, and what you can do about it. Hi, I'm Dr. Zach Ratliff at TruMotion Therapy here in Charlotte, North Carolina, where we specialize in the conservative management of musculoskeletal pain and injuries, meaning that our treatments do not involve the use of drugs, surgery, or long-term care plans. So let's start with what is tennis elbow. Tennis elbow's medical name is lateral epicondylitis. That itis at the end insinuates an inflammatory process, specifically of the tendons of the muscles that run on the outside of our forearm. Now, all of the muscles that extend the wrist and move the fingers are going to attach at a common spot right at that lateral elbow where commonly people get a pain syndrome. Now, this can be from overuse, it can be from intensive workouts, it can be from tennis, but it can be also from a multitude of other things. Now, a common misconception about tennis elbow is that rest will ultimately heal it. The problem with this is that many of us have tried that strategy, and what we've found out is when you rest it, it might feel a little bit better in the interim, but then as soon as you try to re-enter that activity that you love doing, your symptoms immediately re-aggravate. And so what this is pointing to is we have a weakness in that tendon or an insufficiency in that tendon, and it's not able to keep up with the level or dosage of activity that you're doing. So first step of treatment with this, and the good news is that most of these cases can be managed conservatively without the use of surgery or drastic interventions, is that we need to calm down that inflammatory response, and then we need to rebuild that tissue and strengthen it. Now, from a treatment perspective, there are so many great tools that can help in this case. We have laser therapy, we have dry needling, we have shockwave therapy. All of these are going to be great for renormalizing that tissue. But again, ultimately, we need to strengthen that tendon. So there's going to need to be some rehab along with looking up the chain. So it's important to note that that elbow is just one piece along that kinetic chain. And so the elbow might be where we're feeling it, but it could also point to a stability or a mobility issue in the shoulder or even the shoulder blade or even the middle back or the thoracic spine. So it's important to take a full body approach. But again, the great news is that so many of these cases can be managed conservatively, and there is no reason that you can't return to the activities that you love. Now, if you have been struggling with elbow pain, you've been resting it or been unsuccessful in other treatment endeavors, I would encourage you to check out our website at TruMotionTherapy.com, where we have more information and resources, as well as the ability to schedule an appointment with one of our providers, and we would love to take a look, make sure we do a thorough evaluation, and make a great plan for you to get you back doing an activity, whether that's tennis or anything else that you love doing.